Shora. I work as a diabetes specialist in the UK, and we are discussing the questions that sometimes people ask in relation to diabetes. So, one of the questions that sometimes people ask is, what are the problems with having diabetes? What complications does it give rise to? Because they have had members in the family who have had diabetes for many years and haven't come to any harm. So they reasonably assume that it may be a mild diabetes, or that it does not affect life in any major way. So the answer to the question as to what are the issues in relation to having diabetes is that there is nothing like mild diabetes. When the glucose levels are high, as we discussed in the other video, to a certain degree, to label or to justify a label of diabetes, then the person is at risk of developing complications with diabetes. Now, what are these complications? Now, these can be sudden or acute complications, like very high levels of glucose, which may make a person thirsty, drink too much water, pass too much water, lose weight, and in extreme cases, unconsciousness and death may ensue. The other kind of sudden or acute complication could be very low levels of glucose, either because the treatment being given becomes excessive, or the kidneys start failing and the treatment which was reasonable before becomes too much for the person, or the person misses a meal and therefore goes low in terms of glucose levels. So these are the two main acute or sudden complications of diabetes. So what are the chronic or long-term complications of diabetes? Now, diabetes affects body as a silent killer, and with time and with months and years it can affect eyes, kidneys, feet and heart, to the extent that people may have impairment of vision, may develop ulcers in feet which can get infected and may lead to loss of limb, may affect heart and cause heart attack, and may affect circulation and can cause stroke. It can also affect kidneys, and in the long run can cause kidney failure. So, in summary, there are a number of organs which can be affected with diabetes, and it is therefore important to control diabetes. The two main issues with type 2 diabetes is heart attack and stroke. And the issues with type 1 diabetes is the effects on eyes, kidneys, feet and heart on long term. So the next reasonable question which some people ask is then, how do we treat diabetes? Generally, when the diagnosis has been made, the standard advice is to adhere to a healthy diet, which is sometimes called diabetic diet, but is generally and is actually a healthy diet for everybody with or without diabetes, and generally consists of low glucose or low sugar, low fat, low calorie, high fiber diet, which is good for everybody. The next advice given is to do plenty of exercise and lose weight, because the commonest type of diabetes is type 2 diabetes, as I mentioned in the other video, and that is largely because of excessive body weight, which can be controlled. So diet and exercise remains the first modality of treatment for diabetes. But very often that is either not enough or is not possible to an adequate extent by some people, and therefore they need treatment. When the treatment is started, of course it will be guided by your doctor, but in general it is started with oral medications which are in different groups. There are medications which fall in the group of biguanides or metformin. There are medications called sulfonylurea like gliclazide or glibenclamide or glimepiride. There are medications which fall in the group of gliptins like sitagliptin, vildagliptin, saxagliptin and linagliptin and others. And there are drugs called glitazones like pioglitazones. A new class of drugs have emerged called SGLT2 inhibitors, drugs like dapagliflozin, canagliflozin, empagliflozin and other gliflozins, which make people lose glucose in urine and thereby reduces glucose levels in blood. So these are the various types of oral treatments used in people with diabetes, one after the other, the commonest and first being metformin. When the oral treatment is not enough or sufficient, then one is forced to use injectable medications. Some of them actually are helpful by way of making people lose weight also. These are called GLP-1 analogs like Victoza and Byetta. And others are insulins, which can be either short-acting insulin, which cover the meal period, or intermediate or long-acting insulin, which cover the period between meals and the period at night. So these are the complications, and these are the medications that are used in diabetes. In the next video, we will discuss some more questions in relation to diabetes.